Good morning or good afternoon or whatever time you may be watching this video. I'm Dr. Adrian Tinajero. I'm a MOHS certified surgeon and board certified dermatologist. Today we are diving on an exciting and a very important topic in dermatology, which is called MOHS surgery. Nowadays we call it MOHS micrographic surgery, but in the old days, MOHS surgery was referring to Dr. Fred Mohs, who first pioneered this procedure. This is a specialist procedure by which we can remove skin cancer in a safe, accurate, and more importantly, minimizing the amount of tissue that is removed. This is done by removing the skin in layers. We usually do this procedure in places where the amount of tissue that needs to be removed is important, such as the face, the dorsal parts of your hands, genitals, feet, places where we do not want to remove more than is necessary. So this procedure involves removing skin in layers, so to speak, little by little, looking at every corner, looking at every edge, looking at every depth, and making sure that as we remove skin, we only do it into the extent of where the cancer is. This allows us to visualize the cancer live. This is happening in the office, in a lab. There's no more removing and sending you home for several days or weeks just to do this again. This is done within the same day. The first thing that happens on this procedure is your dermatologist, or in our office, we would evaluate the patient for a possible skin cancer. Normally, the first steps would be to take a biopsy. This is a small sample of skin to remove a portion of that lesion and to get tested to prove or disprove the theory, and to analyze the skin and knowing what type of skin cancer, where it is in the skin, and what is the best treatment modality based on that biopsy. Into the procedure itself. It's all done in the office. You're awake. There's no hospital. There's no general anesthesia. Most of the time, this is going to take several hours because the skin is tested in layers. One area is removed. If the cancer is clear, if the margins are no longer involved, that surgery is done, and then we move to the repairing the lesion. If there's more cancer, we will repeat the cycle. We will remove a little more skin and retest it. So quickly, let's go through some key items. Let's call it a checklist for your day of surgery. Number one, you may want to bring a book, a tablet, a phone, or something that you could sort of spend your time doing while you're waiting. Number two, most of the time this is done in the morning, and most surgeries do not require, at least most surgery, do not require for you to fast. So having a good breakfast or lunch, depending on the time, is totally appropriate. Number three, there will be some pain management involved. This means maybe you will be asked to take ibuprofen or Tylenol, or even a prescription narcotic, depending on the location. There will be a follow-up appointment. Most of the time, it's a week later or 10 days later. This will involve removing sutures, bandages, or glue, or whatever they may be. We will give you instructions. You will have a phone number and access to your doctor or to our office if any concerns happen between the time you get your surgery done and the wound is completely healed and back to normal. This is the first stage of a MOHS procedure. In this particular scenario, we're doing a finger drawing where the lesion potentially could be with a marker like that. Take a picture to verify site, and we will use anesthesia, usually lidocaine, a small prick, and then a little bit of pain, unfortunately, but that's brief, usually about 3 to 4 seconds, and then the area starts to get numbed. So at this point, although it kind of hurts a little bit, especially in a finger, this is already numbed. We will then clean the skin with heavy cleanse. Again, this is the skin cancer. We're gonna mark 12 o'clock. Again, that's our point of reference so that we know where the top is in relation to the skin. So now that 12 o'clock is marked, we're gonna take a small margin around what we think the lesion is, usually in a circle way. The skin is removed, and we're only removing the very top layer. The skin is delicately removed. We don't want to pull on it too hard. We don't want to disrupt cancer cells. We just want to remove the tissue. It gets placed on either on a paper or on a dish, and this will be taken to the lab. As other procedures, we are going to use cautery to slow down and minimize bleeding. And oftentimes there might be some bleeding left over, which can be easily stopped with pressure or a dressing. And that is the end of the first stage of MOHS surgery. Now, some people ask me, why is this procedure so important? Well, it's been perfected over decades now, and it has a 99% cure rate, because not only we remove the skin cancer, but we can remove it accurately. There's no longer the guess game of whether I went deep enough or wide enough. We can visualize the cancer cells as we do it, allowing the success rate to be as high as 99%. Now, some keys to remember here. We're gonna remove the skin in layers. There's gonna be some local anesthetic. That means usually an injection. It's important that after the surgery, after the procedure, that there's care. We have to make sure that area heals well, that you can go back to your work, you can go back to whatever it is you were doing as easily as possible. You will walk out with instructions on how to take care of this at home. This may involve keeping the area clean, covered, to avoid exercise and things that may disrupt the skin. Perhaps it may involve avoiding exposure to certain things. Depends on the location, you dermatologist or I may be recommending to take an oral antibiotic. That be necessary depends on the location. Just to review this whole process. A patient that has a skin cancer, usually from a biopsy or a prior visit, presents to an office like mine to conduct a procedure called MOHS surgery. That's a process by which we remove the skin cancer specifically, with the least amount of normal skin. That allows to not only clear it with 99% cure rate, but allows hopefully the best cosmetic outcomes than a traditional excision.